Hi, thanks for joining. My name is Melissa Denham. I am a population health specialist and a nurse with the Villages Health. Today we're going to be talking about heart disease and mental health. Mental health is a very important part of our overall health, and the term refers to a person's emotional, psychological, and social well-being. Our mental health involves how we think, feel, act, and the choices that we make. Some mental health disorders can be short or long term and can actually interfere with the person's mood, behavior, thinking, and ability to relate to others. There are various studies that have shown the impact of trauma, depression, anxiety, and stress on the body, including stress on the heart. We're going to go into a little bit more detail in regards to certain mental health disorders and how it can relate to our well-being as well as our heart health. So what mental health disorders are related to heart disease? These are four that we're going to discuss with this presentation. We have mood disorders, anxiety disorders, PTSD or post-traumatic stress disorder, and chronic stress. Now, there may be other disorders such as substance use that are connected to heart disease, but these are the four that we're going to discuss today. So mood disorders. People living with mood disorders such as major depression or bipolar disorder find that their mood affects both psychological and mental well-being almost every day. This is an ongoing disorder that affects one's mental health. There can be variations throughout the day, but we do know that it pretty much affects every day for the majority of the day. The severity of it could vary though. The next one is anxiety disorder. So with anxiety, people respond to certain objects or situations, possibly with fear, dread, or even terror. Certain anxiety disorders include generalized anxiety, social anxiety, like going into groups of people or meeting up with even one other person. Also could include panic disorders and certain phobias of a very wide variety. The next one is PTSD or post-traumatic stress disorder. People can experience PTSD after undergoing a traumatic life experience. This can be such as going through a war or natural disaster or any other serious incident. Now, this does not necessarily have to be war or the natural disaster. It could also be from a relationship, a stressful relationship where there were some physical or even mental challenges that you experienced with another person. It could be with in a relationship as a couple. It could be growing up as a child, you experience some type of emotional or traumatic things. You could, from any of those pieces, develop PTSD. So any type of post-traumatic situation, you could develop this disorder. And the fourth one is chronic stress. So people are in a state of uncomfortable emotional stress accompanied by predictable biochemical, physiological, and behavioral changes that is constant and persists over an extended period of time. So the key part of this is that it's constant. The word chronic means long term. So this is not just a short term, just a short term thing. This is long lasting. This is going to go on for long periods of time. And it's probably going to be pretty consistent throughout that entire period. Now, the connection between mental health disorders and heart disease. So a large and growing body of research, which is still being evaluated, shows that mental health is associated with risk factors for heart disease before a diagnosis of a mental health disorder and during treatment. These effects can arise both directly through biological pathways and indirectly through risky health behaviors. So we have directly through certain chemical changes and hormonal changes that one is experiencing, but then indirectly through certain behaviors that one may be doing as they're going through the biological changes as well. They may be going through some binge drinking. They may also be going through some other substance abuse or lack of sleep. Maybe they're, instead of getting the correct amount of sleep through the night, they are going out and staying up all hours of the night. They're not on any type of normal sleep routine. So people experiencing depression, anxiety, stress, and even PTSD over a long period of time may experience certain physiologic effects on the body. So these certain mental health disorders, the 4 that we specifically discussed a few slides ago, over long periods of time can affect your body. So the things that we're going to talk about, we're going to relate it to heart. So it could cause some increased heart reactivity, like it might make your heart rate go up, or it might make your blood pressure start to climb. It also could cause reduction of blood flow to the heart. So your heart is pumping, but it's not able to get the proper amount of blood flow to the heart where it needs to be able to function completely and most effectively. It also could cause heightened levels of cortisol in the blood. So overall, these physiologic effects can lead to calcium buildup in the arteries, which is where we could eventually develop some blockages. So over time, with age, we do know that there is some normal buildup within the arteries, but excessive amounts of buildup can lead to heart attack and stroke. It could also lead to some metabolic diseases and heart disease. So these certain disorders that we're experiencing, it's like a chain of events. So you have the disorders, then it could cause a few different types of cardiac symptoms, like your high blood pressure, lowered amount of blood flow to the heart, and then the next chain of event would be potentially a heart attack or stroke. So we're seeing that these symptoms, these disorders could lead to some pretty major disorders and diseases of the heart. Now, some evidence shows that mental health disorders, such as our depression, anxiety, and PTSD that we talked about, can develop after cardiac events, including after a bout of heart failure, after a stroke, even a heart attack. These disorders can be brought on after an acute heart disease event from factors including pain, the fear of death or disability, even financial problems associated with the event. So if one has a heart attack, the post-op and the recovery period from the heart attack, maybe they had to have an open heart surgery. So having a heart attack in itself is already a fearful event. It's also an event that could cause some pain, because if they experienced tightness, heaviness, pressure in the chest, that's a symptom, that's a pain that you're experiencing. And then you have to think about the future. Well, now I have to have open heart surgery. Am I going to make it through the open heart surgery? Are they going to be able to bypass the clogged artery and get that blood flow back to where it needs to be? And then you also may be thinking about the financial burden that you could potentially experience following the ambulance visit from your home to the hospital. And then you have to think about the testing that's done. And then you also have to think about the bill that you're going to receive for your open heart surgery. So there's a lot of pieces for certain cardiac events that could most definitely show some mental health disorders and how quickly and rapidly they could arise. So the depression, anxiety, even PTSD, you could definitely experience those. And there's still a lot of studies that are being done right now to show that these mental health disorders can and do occur after certain cardiac events. So there is that piece, there is that link in between. And again, there's a lot of evidence showing that this is happening, and there's a lot of studying still being done to provide more information. Mental health disorders like anxiety and depression may also increase the chance of adopting behaviors such as smoking, inactive lifestyle, or failure to take the prescribed medication. This is mainly because people experiencing a mental health disorder may have fewer health coping strategies for stressful situations, making it more difficult for them to make healthy lifestyle choices, which then in turn would reduce their risk for heart disease. So having anxiety or depression, some people may say, well, I don't want to go to the gym or join this club because I don't like the stress of being around other people. I don't like crowds of people. I don't like meeting new people. So that may in turn keep them from going out and doing any physical activity because they don't want to get in crowds. They don't want to be around others. So that could lead to the inactive lifestyle, which then in turn could lead to heart disease because you're not getting any physical activity. You're not getting your heart pumping and you're breathing a little elevated, which we know is incredibly necessary to keep our heart health as well as our overall health. So you could see easily how these also could just be a nasty chain of events. You have the social anxiety of being in groups. So you're staying home and you're not going out and getting any physical activity. And then you could develop some depression because number one, you're not socializing. Number two, you're not exercising. And now your heart is not getting the exercise or anything that it needs. So then you could develop some heart diseases. It's a vicious cycle. Now, this is a nice slide. It's actually from the CDC, Centers for Disease Control and Prevention. You can see that it is just a vicious circle here. So we'll start at the bottom here, the bottom right. So possible behavioral pathways, including financial strain, antipsychotic medications, medication non-adherence, not taking your medications as prescribed or taking them at all. Smoking and physical inactivity can then lead to the left to anxiety, depression, chronic stress, even PTSD. And then moving up, possible physiological pathways, including pain, fear, increased cardiac reactivity, reduced blood flow to the heart, and increased cortisol. Then continuing the circle can then lead to stroke, heart failure, cardiovascular disease, metabolic disease, coronary artery calcification, so that buildup of the calcium in the arteries, or even heart attack. And this circle just continues around and around. There's no stop to it. It's a continuous. But you can see in the very middle, we have the heart. We have to take care of our heart, and sometimes being able to acknowledge these certain mental health disorders and make sure we can get the help for that. So then in turn, we can take care of our heart health. It is all connected. So taking care of one, taking care of our physical health with our heart disease is equally as important as taking care of our mental health. Now, some statistics show that there are specific populations that show higher rates of heart disease as a result of pre-existing mental health disorders. So certain populations that have the higher risk are veterans. So veterans that have been into war zones or been into certain areas have a higher rate of heart disease because they may have some PTSD or anxiety or social anxiety. Also, women show higher rates of heart disease as a result of some pre-existing mental health disorders. Others are couples with someone who has PTSD, and that could be from a war zone or it could be from a previous relationship, whether it be emotional or physical that they went through to give them the post-traumatic stress. And another population are certain racial and ethnic minorities. They show higher rates of heart disease as a result of some pre-existing mental health disorders. So these are the statistics. These people we already know have a higher rate of heart disease because of other mental health disorders that they're already experiencing. So first we'll talk about veterans. So there are studies, multiple studies, actually that show veterans are at a higher risk for heart disease, mainly due to PTSD, so post-traumatic stress disorder, as a result of combat. So it could be that they experience some flashbacks of whatever type of combat or what they experienced when they were in combat overseas or wherever that may be. They may also have some PTSD from a survivor piece. Maybe they were with a group of people that half of their squadron was prisoner of war or killed in action, and they are the ones that survived. So that can definitely cause some PTSD because they're the one that made it out, and they're so close with these other people that they were in combat with, and trying to understand, well, I watched this happen to them. Why am I here? Having flashbacks, having fear, even irritability, or just the thought of the trauma or hypervigilance, all of these things that they experienced, certain sounds or certain things that they go through day to day could be a trigger, and they could very quickly have a trigger that would cause this PTSD that could have some, they could have some trouble sleeping, they could have some nightmares, may even feel some abandonment. So veterans are at a very high risk for heart disease because of PTSD. So that's just one piece. Now, this is from the United States Department of Veterans Affairs. So we can see here on the left side, these are just 3 examples of some wars. So Iraqi freedom and enduring freedom. The number of veterans with PTSD during that war is between 11 and 20% of service members have PTSD in a given year. Moving down to Gulf War or Desert Storm, it shows about 12% of veterans from the Gulf War have PTSD in a given year. And then further down, the Vietnam War, it's estimated that 30% of veterans had PTSD in their lifetime. 30% of these people, of the men and women that fought in Vietnam War, experienced some post-traumatic stress disorders at some point in their lifetime. That's a high number of going through a war, going through a combat situation, and then in turn ending with this mental health disorder because of the things that they saw and experienced. Next, we're going to move to women. Studies exclusively focused on women found that PTSD, post-traumatic stress disorder, and depression may have damaging effects on physical health. Physical health, I said, particularly with increased risk for coronary heart disease, related morbidity, and mortality. In 2017, there were 165.92 million women in the US, in the United States, compared to 159.41 million men who experienced this disorder. That's a pretty good difference. I mean, and this was in 2017, so that's 3 years ago now. The numbers are just steadily going up because we do have more awareness of certain mental health disorders, and we're opening it up so people are more comfortable to be able to talk about this. And then in turn, we're also finding more about these heart diseases that people are developing because of these behavioral health, these mental health things that they're experiencing. Next are couples with someone with one or both who has PTSD. So there are comparative studies found that couples where one or both partners had PTSD, post-traumatic stress disorder, experienced more severe conflict, greater anger, and increased cardiovascular reactivity to conflict discussions compared to couples where neither partner had PTSD. So they had more severe conflict, greater anger, and increased cardiovascular reactivity versus in couples where neither of them had any post-traumatic stress disorders. Anger and physiological stress responses to couple discord might contribute to coronary heart disease and heart disease risk within these relationships. So again, we have one or both of the people in a relationship experiencing PTSD are at a higher risk for heart disease, putting them at a higher risk in itself, or they may already have some severity of coronary heart disease. And the fourth one on the list were racial and ethnic minorities. So certain studies, other studies focused on racial and ethnic minority groups, found that depression, stress, and anxiety due to disparities in social determinants of health, adverse childhood experiences, and racism or discrimination could place certain subpopulations at a higher risk for, and there's more than one of these, could place them at a higher risk for hypertension, so high blood pressure, cardiovascular reactivity, heart disease, so some buildup in the arteries of the heart or cardiovascular system, and even poor heart health outcomes. So maybe having that buildup in the arteries, and the outcome of that, it continues to progress and get worse. And the outcome could potentially be heart attack or heart failure. So we do know that there are lots of studies that are still going on. Some have been completed. We already have some numbers, but some studies are still continuing to show that certain groups of people, certain minority groups, that have these mental health disorders are already at a higher risk for high blood pressure, heart disease, or other poor heart health outcomes. So those are the four that we really were going to focus on. Now this graph here, this shows heart disease is the leading cause of death for women and men, regardless of race and ethnicity. So the very top, we have African American females and African American males. So 47.3% of females and 44.8% of males show that they are at a higher risk and have heart disease. Now, 82.6 million American adults have heart disease. But again, this table shows with the different ethnicities and races, the percentage in general with American adults. So you can see with white males and white females, 37.4 and 33.8%. And then at the bottom, Hispanic or Latino females or Hispanic Latino males are 30.9 and 30.7%. So the graph shows African American males and females are at a higher percentage of having heart disease. So what can be done? What can we do? Addressing mental health disorders early by providing access to appropriate services and support to increase healthier behaviors, like increasing your physical activity, starting a better diet, and reduced or stopped smoking, can automatically reduce someone's risk of experiencing a heart disease or heart disease event. Number one, we want to recognize the signs and symptoms of mental health disorders and heart disease. Number two, talk to your physician or your healthcare provider about potential heart conditions in relation to your mental health disorder. And then ask them, what are the treatment options? What can we do? If we already know that you're at a higher risk for certain heart diseases and you do have a mental health disorder, talk to your healthcare provider. Talk about the combination of these two situations that you're experiencing and say, hey, what can we do? What can we do now? Let's be proactive. Number three is know that your family history and genetic factors likely play some role in your risk for heart disease. If your father and your father's father and your father's father's father, I mean, if we continue to go back on the family tree, and every one of the males had heart disease or experienced a heart attack, you're at a higher risk. So acknowledging and knowing your family history and the genetic factors is very important. If you do know your family history, make sure you share that with your provider, because that's an important piece for them to be able to see the whole picture and see if there's any pre-existing conditions that maybe we don't know about yet. But if we can do some testing, we might be able to catch it early. Number 4 is know what conditions increase the risk of heart disease. So if you do have heart disease, or if you're at a very high risk, know the conditions about it, know the symptoms about it, know what can put you at a higher risk for having a cardiac event. And number 5, probably the most important, is maintain a healthy lifestyle. So make sure you're getting at least 150 minutes of physical activity in each week. If it can be at moderate intensity, which means you can talk while you're doing the activity, but you can't sing. That's the talk test. So if you're going for a walk and you can talk, but you can't sing, that's the perfect pace. That's where you should be. But 150 minutes a week is what is suggested. Also, for your diet, make sure you're trying to eat lots of fresh fruits and veggies, as well as lots of whole grains, trying to cut back on the sugary or sweets, and trying to eat leaner protein. And also being aware of your family history and any symptoms or questions that you have, talk to your doctor. That's what your healthcare provider and your healthcare team is there for. They're there to take care of you as a whole. So if there's anything that maybe you have a question about or something new that you're experiencing, let them know so they can, again, look at the whole picture and see what's going on. Maybe it's being caused from another condition that you have. So talk to the doctor. Make sure you try to maintain a healthy lifestyle. And if you are on medications, take them as directed. Try to take them the same time every day and try not to miss doses. That's very important. So your healthy lifestyle, this is a nice little picture here that shows we want to make sure we get in our physical activity like we just discussed. Our diet is extremely important. Also make sure you're getting plenty of water. We don't want to get dehydrated. Water is important for our entire bodily system. Also, our sleep is important. So trying to maintain a good sleep routine, trying to go to sleep around the same time, getting that nice REM sleep, that deep sleep that we know our body needs to regenerate and fix anything inside that may be interrupting the normal system. All of these pieces are important for a healthy lifestyle. If you are smoking, we know we need to stop. Stopping smoking will greatly reduce your risk for heart disease as well as some other medical conditions. And then try to maintain a healthy weight. If you talk to your doctor and you don't know what your suggested weight range is, they can tell you. They can do a BMI. They can let you know your BMI, your basal metabolic, your BMI, that measures your height and weight and tells you what percentage of you and what range you're in. Are you in the normal range? Are you in an overweight range? Are you in an obese or morbidly obese? They'll tell you what category your height and weight matches up to and where you potentially should be. And then you can work with all of these other things on the picture to try to maintain and get in that suggested goal. All right, so the physical activity, this is going to break it down a little bit more of what we just went over. So again, according to the physical activity guidelines for Americans, you should do at least 150 minutes. Now, if you want to do those in 2 days, that's okay. If you want to do some exercise or activity every day of the week, that's okay too. But the 150 minutes a week is the suggested goal. Now, the moderate intensity, that is the talk test. So if you can talk while you're walking, but you cannot sing out loud, you're at the right rate. If you're walking and singing, you need to pick up the pace a little bit. Or if you can dance and sing, you need to dance a little bit faster. It needs to be more intense to get the full benefit. Also, be active at least 3 days a week is best, but remember, doing something is better than doing nothing. You should also do muscle strengthening activities like lifting weights or doing sit-ups. Even if you want to get some light weights or some of the resistance bands, If you can, try at least 2 days a week because we want to make sure we're working every single muscle group. Some people forget their lower body, and your lower body is what keeps you standing. It keeps you to be able to walk. So don't forget the muscles in your legs and your lower body. The picture on the left shows the 4 different parts of physical activity. So your endurance, that's your aerobic or cardiovascular activities, your strength training involving pushing or pulling weight, and then balance and flexibility, those two go hand in hand. So trying to make sure we're incorporating all 4 pieces in our physical activity weekly schedule is the most ideal. Now, this is our diet. So we discussed that we want to eat lots of fresh fruits and veggies. So this is what your plate should look like as recommended by the choosemyplate.gov. So focus on whole fruits and make sure you get a good variety on your vegetables. So if you go into the produce section of a grocery store, you'll see the different colors and varieties of the produce. So those different colors provide your body with different vitamins and nutrients that it needs. Aside from getting bored, if you just eat one vegetable for the rest of your life, then you may not ever want to eat that one again. So try to mix it up, get a good variety, different colors, different textures, but at least half of your plate, try to fill that with fruits and veggies. Make half your grains whole grains. So a quarter of your plate should be filled with whole grains. And then you should have some low-fat or fat-free dairy. It could be milk or yogurt. It could even be some types of cheese, but make sure it's low-fat or fat-free. And then with your protein, make sure it's lean protein. So if you're eating chicken, try to pull the skin off before you cook it, because when you cook it with the skin, those fat oils do soak into the meat. So get a good variety. If you can, eat at least 2 servings of fish a week. That is the suggested amount. But get a variety, mix it up. And then drink and eat less sodium, saturated fat, and added sugars. We know all of those things can negatively impact our body. So trying to cut back on the foods and drinks that we put into our body. So we want to cut back on the sodium, saturated fat, and added sugars. All of those, you can check the food labels on the foods that you're purchasing to see how much of each of those is in it. And if you do want to go to choosemyplate.gov, it gives you some more examples, and it goes into more detail about these different categories that we see here on the plate. Now, back to the smoking. If you do smoke, we want to stop. So we have tobaccofreeflorida.com. There are 3 easy and free ways to quit. So there's a quit coach line. You can call the number listed there, 1-877-YOU-CAN-NOW. Also, you can go on the www.quitnow.net/Florida. It's a fairly simple website. You can go on there and they can go through some different ways to help you quit. And then there are some face-to-face local classes also if you need that accountability piece. Now, the Tobacco Free Florida can provide lozenges, patches, and gum for the nicotine replacements to help you stop. So we can slowly read about and replacing the nicotine with these nicotine replacements, which can then in turn, we can reduce that and stop altogether. This is a list of the resources that we have used for this presentation. We referenced the CDC, also the National Institute of Mental Health, as well as the American Heart Association. So these are 3 websites relating to the content in this presentation. If you want to go onto any of these websites, you can get a lot more details. If you have any questions, however, you can contact the Village's Health. We'll be more than happy to go over any questions or concerns that you have, or to provide some more details if needed. I hope you have enjoyed this presentation. If you have a smartphone, we do encourage you to take a brief survey on this presentation. So you can get your camera out, focus it on the QR code here, and it should bring up a link where you can complete a brief evaluation. Let us know what you think. Give us your feedback. Did you enjoy it? Did you not enjoy it? Is there something you wish we would have touched? So please share your feedback. That's how we continue to make these presentations and create new ones. Again, thank you for joining, and I hope you have a great day. Take care.